I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. It's 2017, and we have a lot of different questions surrounding healthcare coverage and what delivery will look like in the future. And who best to answer that is John Rother, who is President and CEO, National Coalition on Healthcare. Good to see you, John.
Good to be here.
Well, we certainly have a lot of questions. I think people aren't really sure what the future holds, but we do know that certain insurance plans have already said that they're not coming back and offering insurance plans in certain markets. How big of a concern is that for you?
Well, it's a real concern for two reasons. One, people in the individual market may not have access to insurance in those areas unless somebody steps forward, and we hope they do. But also, the whole idea of this Affordable Care Act was to have competition, and that was going to help keep care affordable. So without competition, you're not going to have as affordable insurance, and that's a concern too.
Well, you mentioned we hope that companies will step up and offer coverage, but what's the incentive for them to do so?
Well, the government would have to do something to reward companies for stepping in, because otherwise we are facing a very grim situation.
Well, how confident are you that, given the way things stand with the current administration, that they will step up to provide the incentives for these companies to come in?
Well, I don't think that anyone can be very confident at the moment. There's maximum uncertainty as the Congress debates whether to repeal, replace. But hopefully when that gets settled, then we can go forward and try to deal with some of these issues. But right now, it's a maximum uncertainty, and of course that's what makes the insurance companies very nervous.
We certainly have an opportunity, it seems, to have a do-over in this area. There seems to be a real opportunity for companies to maybe mold the system into the way they'd like it to be molded into. What ideally would you like to see if that is the case?
Well, I think that two things have to happen. One is we have to settle legislatively what the framework is for health insurance for the individual market. And then secondly, we need to restore the cost-sharing subsidies that allow insurers to make care more affordable for people. And if those two can happen, then I think we're back on a pretty constructive path. But if they don't happen, then we're in real trouble, and we may have to kind of try something else.
Okay, and what options will consumers have while we wait?
Well, this is the problem, because consumers won't have options unless companies offer policies, and we don't really know yet what to say to consumers, and I think that's a real problem. Of course, people who have insurance today will have it for the remainder of the year, but pretty soon we're going to have insurers file rates and benefits for next year, and that's where we face a problem.
Okay. Now, John, consumers seem to be caught in the middle here then. What are their options if they do have a pre-existing condition and they have not signed up for care previously? Are they still sort of in the middle there without any
Well, under current law,
assistance?
they can enroll without penalty and be covered.
Under the current law?
Under current law.
ACA law?
Yes. And that's a very important thing, because so many people have pre-existing conditions, and of course those are the most expensive people to cover. So most of them probably have some form of coverage. But this is the focus of the debate in Congress right now, is whether to guarantee people with pre-existing conditions, whether they will have coverage, or whether that's up to the state to decide. And that's maximum uncertainty then. So I think it's a concern. We've got to get this nailed down so people can count on coverage.
You'll be speaking later today
Yes.
On a panel, What's Ahead for Healthcare in the Current Congress and Trump administration. We've
Indeed.
covered a lot of those questions. What more will you be adding to the discussion later on?
Well, one of the things that's definitely going to be on the agenda is the cost of prescription drugs. That's actually the top concern of most Americans today, both Democratic and Republican. And prices of drugs have been escalating very rapidly, both for generics and for brand drugs. And that's got to be addressed one way or the other soon. Otherwise, we're simply not going to be able to afford the drugs that people need to stay healthy and stay out of the hospital. And it's going to cost us more in the long run. So this is an important topic.
Okay, a lot of questions remain.
Yes.
We look forward to exploring this further with you down the road. Thank you, John.
You're welcome.
And I'm Mabel Jong. Thanks for watching. You're watching Continuing Coverage.